Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers ethical and cultural influences in community health. By the end of this lesson, you should be able to describe a brief history of ethics of nursing in community health. You should be able to understand and discuss ethical decision-making processes. You should be able to compare and contrast ethical theories and principles, virtual ethics, ethics of care, and feminist ethics. You should be able to describe how ethics is part of the core functions of nursing in community. You should analyze codes of ethics for nursing and for public health. You should apply ethics of advocacy to nursing and community, discuss ways that culture affects nursing practice, describe methods of developing cultural competence, evaluate cultural organizational factors that impact health and illness, be able to perform a competent cultural assessment to promote positive health outcomes for clients. You have heard a lot of the concepts that we're going to discuss in ethical decision making before. Nursing has a rich heritage of ethics and morality. We date back from Florence Nightingale. The field of bioethics began to emerge and influence nursing in the late 1960s. Ethical decision making is the component of ethics that focuses on the process of how ethical decisions are made. So when we talk about ethical decision making, we're talking about how the process we go through to make ethical decisions. Many different ethical decision making frameworks exist. However, the problem solving process underlies each of them. So a nurse has to have problem solving skills to be able to apply any of the ethical decision making frameworks that are available. Okay, ethical decision making applies to all approaches of ethics. There's different kinds of way to approach ethics. You're going to hear of utilitarianism. You're going to hear of deontology. You're going to hear of principalism. You're going to hear of virtual ethics. And you're also going to hear of the ethics of care. And you're also going to hear of feminist ethics. When we talk about utilitarianism, if you remember, it is a well-known consequentialist ethical theory where you look at outcomes or consequences in determining which choice to make. Okay, so in utilitarianism, the moral value of an action is determined by its overall benefit. So you're going to be looking at, because the outcome is the key factor, you're going to hear people say the end that justifies the means. Utilitarianism. In deontology, nurses deal with options related to fundamental beliefs. In these circumstances, these nurses may conclude that the action is right or wrong in itself, regardless of the amount of good that may come out of it. So deontology looks at it from, it doesn't matter whether it brings good or not, but is the action itself a good thing or is it a bad thing? So that's deontology. Deontology deals with adhering to moral values or the duty rather than the consequences of an action. Health professionals have specific obligations that exist because of the practices and the goals of our profession. So these healthcare obligations can be interpreted in terms of a set of principles in bioethics. So this approach using obligations is called principalism. So principalism is using healthcare obligations. So we know that in healthcare we want to make sure that we have respect for autonomy. We want to make sure that we non-maleficence, beneficence, and distributive justice are things that are important when we think about principalism. When nurses talk about virtual ethics, one of the oldest theories, dates back in ancient Greek philosophy. They're thinking about, the person is thinking about, what kind of person should I be? Virtues are acquired excellent traits of character that dispose humans to act according to their natural good. Caring of care, ethic of care, and feminist ethics are also interrelated a little bit, and they converged in the 1980s. The beliefs that feminist ethics are relevant to nursing, yet many have been hesitant to really take on that view. Feminists are women and men who hold a worldview of advocating for economic, social, political status for women that is equivalent to that of men. So you may see that also being thrown around. So let's come back to this. Cultural diversity and more distress make ethical decisions more challenging. We need to know that classical ethical theories like utilitarianism and deontology are key. One of the rules in deontology of decision making is to determine whether the proposed action can be generalized so that all persons in similar situations are treated similarly. So we talked about that. Principalism consists of respectful autonomy. Remember, the respectful principles that are really established that are part of nursing care. Okay, so principalism suggests that a nurse examine the context and make the decisions that can be morally justified within that context. Remember, we talked about virtual ethics and feminist ethics. The most important thing we need to talk about is that the core functions of nursing, public health nursing, are grounded in ethics. They're grounded in ethics, so it's important for you to have a very good command of that. The Healthy People 2020 addresses access to care. That's a good example. The ethical theory of egalitarianism suggests that everyone is entitled to equal rights, equal treatment, and equal share of goods in society, and that the government's role is to ensure that this happens at least on a basic level. Okay, two factors affecting the ethical decision-making frameworks are the growing multiculturalism in America that affects ethics, and moral distress also affects ethics. First, nurses often deal with ethical issues and dilemmas related to the diverse and at times conflicting values that result from ethnicity. But from a moral perspective, what should the nurse do when facing conflicts in ethnicity? Well, a person named Callahan, co-founder of the Hastings Center, explained these conflicts. He described the following four situations in which ethnic diversity can be judged in relation to cultural standards. Think about when you're making the decisions using these four guides. Situations that place person in direct risk or harm. Okay? This can be psychological or physical risk. Think of situations in which ethnic cultural standards conflict with professional standards. So maybe it works for the culture, but does it work for our profession? Situations in which the greater community's values are jeopardized by specific ethnic values. That's going to be something you probably can use as a guide. Situations in which specific ethnic community customs are annoying but not problematic for the greater good. Okay, so those are different things you can think about as far as a way to guide you in your ethical decision making. Okay, so the 2001 Code of Ethics for Nurses contains 9 statements that address the moral standards that delineate nursing's values, goals, and obligations. In 2002, Code of Ethics for Public Health contains 12 statements that address the moral standards that delineate a public health values, goals, and obligations. These are the two things that are going to serve as an ethical guide for the public health nurse. One is for nurses, and then one is for specifically for public health. Okay, advocacy is an act of pleading or supporting an action on behalf of a group of person that the Code of Ethics for Nurses with interpretive statements and the principles and ethical values of public health scope and the standards all address advocacy. Actually, the NCLEX also addresses the role of advocacy for nurses. Okay, the products of advocacy are decreased morbidity and mortality. You see that when you advocate for your patients, the mortality and morbidity rates decrease. The process of public health advocacy include, but are not limited to, identifying the problem, collecting the data, developing and endorsing regulation and legislation, enforcing policies by nurses, and assessing the policy process. Okay? Another thing I want to mention is immigrant health issues. The population of the United States is increasingly diverse, and there's changes in immigration laws and policies that have increased migration, okay, and contributed to changes in community demographics, okay, and heightened need for recognized impact of culture on healthcare, and the need for nurses to learn about the culture of individuals to whom they give care to. Okay, so the United States is a multicultural nation with diverse groups and diverse values. Before any intervention can be made by the public health nurse, the healthcare professionals must understand families' cultural, psychological, social, communal, and environmental contexts, because the contexts affect the way issues are formulated and how decisions are made. You've had several lessons discussing culture. Culture is a learned set of behaviors that is widely shared among a group of people. You know that culture of the people help guide individuals in problem solving and in decision making. So it's very important that nurses understand how people are making those decisions and how they're solving those problems. Okay, cultural competent nursing care is designed for a specific client, reflects the individual's values and beliefs, and it is provided with sensitivity. So nursing care helps, cultural competent nursing care helps improve the health and outcomes, and also reduce healthcare costs, because the patient is more likely to adhere to it. Okay, what does it mean to be culturally competent? The nurse who is culturally competent uses cultural knowledge as well as specific skills such as intercultural communication, cultural assessment in selecting interventions for those clients. 4 modes of actions that nurses may use to negotiate with the client and give cultural competent care that we want to talk about are cultural accommodation. This is all not any new information. Actually, cultural preservation, cultural accommodation, cultural repartitioning, and cultural brokering. You should know these terminologies and you should be able to apply them in a test question. Cultural skill is the effective integration of cultural knowledge and awareness to meet a client needs. The nurse uses cultural skill to make sure nonverbal communication techniques take into consideration the client's body language. That's a good example. Cultural skill involves the provision of care that is beneficial and safe and satisfying to a client. Read the definitions of the other terminology that you're already familiar with. We know that there are several barriers to culturally competent care that we want to talk about. Barriers to cultural competent care include stereotyping. We know what that means. We should be able to apply that in a test question. This is a review for you. Prejudice, racism, ethnocentrism, cultural imposition, cultural conflict, and cultural shock. All these things are important for us to revisit while we're talking about community health. Okay? You need to be able to define what these are, and you should be able to give examples of those. Okay? Communication with the client is, and the family is required for careful assessment of any patient. When nurses do not speak or understand the client's language, you should also obtain an interpreter. You should know that. The nurse must use strategies that will allow effective communication with the client, and the client has a right to receive care, to judge whether the care was appropriate, and to follow with appropriate care actions when that care is not received. Okay, cultural nursing assessment. Nurses should perform a cultural assessment on every patient with whom they have interaction with. Cultural assessments help the nurse understand the client's perspective on health and illness, and they also help guide what the nurse should do. The needs of a client vary with age, education, religion, socioeconomic status, and among many factors. We talked about an interpreter, and selecting an interpreter is an important aspect of providing cultural sensitive nursing care, okay? Efforts to understand dietary practices should go beyond relying on membership in a group. You should actually be doing that. Members of the minority group, remember, that are overrepresented in the lower tiers of the socioeconomic ladder. So you may see poor economic achievement. This is a common characteristics among populations at risk. Those that are at risk for poverty and homelessness, and migrant workers and refugees. Nurses should be able to distinguish between cultural issues and socioeconomic class issues, and not interpret the behavior as having a cultural origin when it's based on a socioeconomic class, because that causes you to have bias. Thank you for listening into this lesson. I hope you have enjoyed this quick overview of ethical and cultural influences in community health. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.